Good morning, good afternoon, and good evening, everyone. My name is Aaron Salzberg. I'm the director of the Water Institute at the University of North Carolina, and it's my pleasure to welcome all of you to today's webinar on ensuring the financial sustainability of utilities during the COVID-19 pandemic. A little bit about us. The Water Institute at UNC is located in Chapel Hill in North Carolina, and our goal is to advance water security through research, policy, and practice. We're organizing today's event as a member of Sanitation and Water for All. SWA is a global partnership of governments, civil society organizations, and other development partners working together to achieve universal access to clean water and sanitation. The Water Institute is one of many scientific and academic institutions within the research and learning constituency of SWA. We're all working together to ensure that policymakers and practitioners have the evidence that they need to make sound decisions around WASH. We're glad that all of you can join us this morning, this afternoon. In many ways, this issue brings together two major issues dominating our headlines today. The first is, how do we ensure that people have access to the basic services they need to reduce the spread and address the impacts of COVID-19? And the second is, how do we protect the fundamental rights of all individuals, especially marginalized populations? Water's role in controlling the spread of infectious diseases is well established. I think we're all comfortable with that, along with personal protective equipment, disinfection supplies, the sound treatment of hazardous waste, training to support healthcare workers and cleaners. WASH interventions are essential to combating COVID-19. And for this, we need fully functioning water utilities. Unfortunately, the economic impacts of COVID are making it increasingly difficult for utilities to recover their costs. And this is already threatening service delivery, drinking water quality, and jobs. In the long term, utilities may have to forego future capital expenditures that will, at best, limit future growth, but at worst, drag them into a financial hole that they won't be able to get out of. We don't have a lot of quantitative data on this, but here in the United States, where I live, the American Water Works Association has assessed that the aggregate financial impact of COVID-19 on U.S. drinking water utilities will be approximately $14 billion. A decline in capital expenditures could lead to the loss of 75 to 90,000 private sector jobs just here in the United States. The long-term aggregate impact on the U.S. economy could be as much as $33 billion. So this is not an insignificant problem. So how do we balance these issues of human health, equity and equality, and then the financial sustainability of utilities that provide these essential services? And that's our conversation for today. I'm really excited about that. The moderator for today's discussions will be Clarissa Brocklehurst, an adjunct faculty member at the Water Institute here at UNC. And just before turning it over to Clarissa, I'm looking at a lot of close friends on the video screen. Just a quick word of thanks to all of our speakers and all of our panelists for joining us, and for all of you listening in today. We really appreciate your time and attention. It's never very easy, and particularly now, but we very much appreciate that. Clarissa, over to you, and I'm really excited to listen into the program.
Thanks very much, Aaron. Thanks for that great introduction, and welcome to all the people who are joining us. I can see many of you are already announcing yourselves in the chat box. Before I launch into the moderation of the panel, this great panel we've got, I'm going to call on Marissa Striley just to do a little bit of housekeeping to explain to you how some of the features of this Zoom platform work. Marissa?
Hi, everyone. Today we are offering interpretation for the webinar. So at the bottom of your screen and your control panel where you see participants or the chat box, you should see an icon which looks like a globe. And there you should be able to select the language. We request that you select either English or French. Even if you are already able to hear the language without selecting one of those, please do, because when there is interpretation, you'll be able to hear it back and forth. If you have any difficulty with that, please let us know in the chat box and we can help find a solution for that. The other thing is we'd be grateful if you listed your name and the organization that you represent and where you're joining from in the chat box. That'd be very helpful. And then finally, we are not using a Q&A function on Zoom. We're asking that participants place their questions for the panelists in the chat box also, and we'll keep an eye on them and make sure that we get them to Clarissa to be able to share with the panelists. That's it. Thanks, Clarissa.
Great. Thank you very much, Marissa. And let me add my welcome to all of you. So today's virtual forum is in two interlinked parts. First, we're going to hear from a panel about the global situation facing us in terms of consumer protection and utility financial stability. And then we're going to shine a spotlight on the particular situation of Ghana. What I'm going to do now is, I think Joost is going to put up the slide that tells you who our first panel is. And without further ado, I'd like to get the discussion started. I'll introduce the panelists as I go along, but you can see the list on the slide we have up now. So what I'm going to do is I'm going to start by calling on Al-Hassam Adam, who is the coordinator of End Water Poverty, which is a global coalition of NGOs, trade unions, and social movements working to end injustice in access to water and sanitation. As Aaron has said, we know that water is crucial in order to allow hand washing that protects people against in the fight against COVID-19. But not everyone has easy access to water. So what are the civil society organizations who are part of End Water Poverty asking for? And what are their concerns with respect to protecting the public and to vulnerable water users? Adam, can you speak a bit, Al-Hassam, can you speak a bit about that?
Yeah, thank you for inviting me to this discussion forum. Basically, from End Water Poverty perspective, when everybody is banging on hand washing, but also we are forgetting the fact that there are people who are struggling to get water. So what we did was to launch a petition calling on all governments and utilities to make sure that at this particular point, there is no disconnection for people to have access to water, and also for government to pay the bills for people who cannot pay for water services. So we've launched a global petition on this, and so far we've had close to 650 organizations and individuals have signed on this petition. But what we are saying in this petition is not just for government to make sure that people have access to water based on the human rights criteria, which is about safe water. But at the same time, government put in plans to pay the utilities the water that they are providing for people who cannot afford, and also making sure that those who are not disconnected, they pay for those services, and also pay for the consumption that public institutions will be having within this period and beyond. And already we know that a lot of public institutions consume water, which is just called non-revenue water, and nobody pays for that. And with the collaboration of Water Integrity Initiative, we've kind of did a couple of surveys to look at this issue, and I'll talk to it later in the discussion.
Okay. Thank you very much, Al-Hassam. That's a great way to kick off our conversation. We know that this is an important issue, protecting vulnerable consumers, but I'd like to turn now to two people on the panel who work for utilities. Mrs. Jabule Lele Mashwama is the Managing Director of the Eswatini Water Service Corporation, and Mr. Dominique Gattel works for the French water company Veolia and also chairs the International Committee of the French Federation of Water Companies. We know that calls for free or discounted water are being heard all over the world. In fact, our representatives from Ghana will soon be telling us about the situation there, where the president declared that all water would be free to everybody for 3 months. But these calls come at a difficult time for utilities. I'd like to hear from both of you what impact the pandemic has had on the revenues of utilities and what concerns you have about both immediate liquidity and long-term financial impacts. And also perhaps tell us a bit about what the response of your utilities have been in terms of the calls for protection of vulnerable customers. Jabu, can I go to you first to speak from the perspective of Eswatini?
Yes, thank you very much, Clarissa, and I want to greet everyone. Good afternoon from my end, and thank you for having us. When we were invited to this webinar, we're very excited, primarily because we think we'll get more than we will give, and it's a topic that's very topical in our area as well. So specifically, just speaking to that issue of what have we done and what has been the situation in Eswatini. When COVID hit the nation, the utility was already, and utilities, I think, generally in our region, we're already experiencing a lot of challenges and the pressure on their bottom line, primarily because they are structured, and ours specifically structured to be a non-profit making organization, but mainly it is an arm of government to provide water, to increase the access of water and provide water and sanitation services, initially to the urban areas, and because of our national development plans and the general SDGs, we are seeing ourselves moving more and more into the rural areas, which presents even a bigger challenge. So because people have the notion already that water is supposed to be a free service, or at least access to water is supposed to be a right given to them freely, you find that it becomes a little difficult sometimes to get revenue back and to collect our revenues from the provision from the services that we provide. So we were already, our bottom line was already stressed. And then we entered into the pandemic era where the government actually announced a state of emergency. And we found ourselves with more pressure to provide water at no cost, and people saying that they should not be disconnected specifically. And our position as a utility was that, one, we are mandated by the government to ensure that we continue to provide services in this regard. And we are not subvented in any shape or form, except for when we put in infrastructure on the ground. The government definitely puts in help, assists in that. So we had to look at ways of how do we then assist, because we also understand the need to provide water for those that are unable to reach. So one of the key things that we did was, let's look at how do we ensure that during this period there is no increases, because we're supposed to increase our water tariff in this period. So there was a break given, which is obviously pressed down even further our finances, and so we didn't increase our tariffs for 3 months. And then, because we understand that there are some areas that actually have no access at all, we worked with the National Disaster Management Agency to provide free water on tankered water in specific areas, strategically positioned across the country, particularly in the rural areas, so that people could at least have sufficient water to wash their hands during this period. So this program is currently ongoing. Having done that and continued with other initiatives, what are we experiencing specifically now as a utility? Specifically as a utility, we're getting more pressure for people expecting that water should be provided free. We are getting, our services are not being paid for timelessly, and we are therefore not able to collect the money to be able to go and invest again into the chemicals and all of that. And our position in our picture obviously is that there is an understanding that needs to be delivered and made known to the stakeholders in terms of understanding what does free water mean. How do you get access to free water? We actually absolutely subscribe and respect the aspect that water is actually a human right, but access to it must be therefore provided in a very cost-effective manner. So how do we ensure that water is affordable? It's been our greatest agenda. Let's look at how we make sure that water is affordable. And we already had, because of the nature of our setup, a tariff structure that looks at the pro-poor, and it says at the bottom of the pyramid, those people should be able to get water at costs that are actually very, very affordable. So we have a staggered approach in our tariff structure. And secondly, even the increase that was muted, that is supposed to be coming on in the near future, it made sure that standpipes or waters that are provided for communities around the country in standpipes, that band does not get an increase. so that water remains affordable. But we just think there's a lot of education that needs to be done for people to understand that having a human right does not necessarily make it absolutely free. It says there's a service that must be accessible, and how do you ensure that it is affordable. The same way that food and shelter is also supposed to be a human right, but you pay for it. It's just the government and the utilities' responsibility is to ensure that it is kept as affordable as possible. So that's been the conundrum that we're at. But in terms of how we are operating, we are feeling it, and we are feeling a significant pressure. And our cry and our greatest frustration is that if we are unable to continue to provide this service, then the pandemic will have a bigger impact on our nation. So we need to keep our services alive, because it is actually one of the key pillars of ensuring that this pandemic does not wipe out our nation. And how do we keep it alive? By collecting back from our suppliers the little money that is due, and ensuring that we can buy the chemicals again, we can provide the service, etc. And
that's very much. Yeah. Excellent. Okay, and an excellent explanation of as you say, the conundrum you find yourselves in. Thank you very much. Dominic, I'll turn to you. So you represent private water utilities. Do you want to tell us a bit about your perspective and how you see this, and whether there are parallels with what Jabu has just spoken about?
Well, certainly there is a lot of parallels. Definitely in terms of the how can I say that, the compliance with the right to water. That's something in the country which I represent today. That's something which has been tabled by at state level. I think it's quite important, generally speaking, that the sovereign states, I mean, do give body to this human right to water and sanitation, and it's exactly what happened long ago in France. Whereby all the criteria for water and sanitation, I mean, are duly tabled in the French law. Definitely access is mandatory. I mean, it's the hands of the municipalities, but still it is mandatory. In terms of the affordability, that's also something to be decided by the municipalities. The quality of the drinking water and its compliance is decided at French level, and as a matter of fact, I mean, it follows the lines of the European Union, etc. So to make it short, I mean, that's all very tightly set in the French law overall. Attached to it, there is two settings in France. One is that municipalities should totally recover the cost through the tariffs. I will go into more detail about it, but in other words, the water money is ring-fenced from the outside, so the municipality can neither subsidize the water sector nor can it benefit of it. And the other last option which the municipality have is to operate themselves or to outsource through a transparent tender if they prefer to have the service delivered by private operators. And I very much insist on this regulatory regime, which ensures by itself that the water is accessible, is compliant, etc. And that has proved to be an asset in fighting the current crisis, definitely in terms of guaranteeing all the time that the water would remain accessible to everyone, would remain of good quality. I mean, we haven't had any non-compliance during the entire period, etc. And likewise, by the way, we also ensure the safety of the workers in both water and definitely on the sanitation side, which was also an issue to be addressed. During the crisis, and which is still the case now, I mean, we could benefit of a number of assets which were established together with our client municipalities. The first one is the crisis management tools and the crisis management plans that were established long ago, and we have an experience with the business continuity in crisis management during hurricanes, pandemics, earlier pandemics, earthquakes, etc. And that's something which enabled us to develop specific tools to manage the crisis. Definitely, we didn't touch on that yet, but digitalization has proven to be an asset. The mutualization of means, definitely, I mean, at corporate level, I mean, we have the means to source or reshuffle our supply chain to adapt to the very challenging circumstances. In terms of your question about the liquidity, yes, there is an impact on the crisis on the revenue. And since we have to cover our costs, and again, that's a legal obligation, whatever the operator and its nature, whether public or private. And so, to make it short, the cost to be covered, 40% of the cost of a utility is capex, 30% is the staff, 30% are the supplies. And as you can guess, there is no mean we can reduce the staff. There is no mean we can reduce the consumption of supplies. And so obviously the margin of maneuver is with regards to the capex planification and what are the capex which we prioritize when the finance are under strong constraints as it is at the moment and for the 2 next years to come.
So just to follow up with both you and Jabu, I hope she's still there. She can turn her video back on. One of the things I'd like to follow up with you is what you think is the long-term perspective in terms of planned investments, and I think Jabu talked a bit about that as well. But also, what, from your perspective, should the role of central government be? And I know that Jabu has a sort of two perspectives on this, because you used to be the Minister of Water as well, so you've worn that hat, as it were. But just before I turn to Georgia to give the regulatory response, I wondered if you just wanted to speak about what you feel should be the role of government in this situation.
Thank you, Clarissa. I think the role of government is to continue to ensure, to advocate and to manage utilities to ensure that they are actually delivering in the most cost-effective way. So that's primarily important. And to educate the populace in terms of how we should ensure that together we work together to try and achieve this particular goal that we all have an interest in, and to ensure that the WASH forums, which actually are the forums that take care of all the sectors, to lead and ensure that those forums are actually effective in delivering what is required, because it is in all of us collaborating and working together that we'll be able to achieve this. And in our instance in particular, it's for government to continue in the investments of infrastructure, because it's government that actually lays out the infrastructure to increase the access, and then hands it over perhaps to us to be able to manage. So I think it is that, but education and speaking to the issues that the population needs to understand is very, very important in our instance. And I think government could take the lead in that and ensuring that that is done. The other critical thing is in terms of in climate change and environmental issues in particular, government from the position where she stands, she can be able to make the people understand that if we better all utilize the water sources better, it will make provision of water to be much cheaper and more affordable in the long run. So we need to put these things together and ensure that we get the population to assist itself to get this access in terms of managing upfront the issues that pertain to water provision.
Thanks very much. And Dominique, I'll turn back to you.
Yes, well, the government is the duty bearer in terms of the right to water and sanitation, and it's definitely for the central government to put this in, again, to give body to this right to water and sanitation. If I take the example again in my home country, the government has long ago planned, I mean, the way the water finance should be recovered. And that includes a number of settings. The disconnection are banned in our country, at least for households. The other thing is, with the current settings, the affordability criteria, there is this limit which is set by the OECD at 3% of the revenue of the poorest households. And the OECD equally found out very recently in a report that in France, in average, the fifth poorest percentile, I mean, only pays 1.5% of its revenue to cover the water bill. So that means that in generic terms, the affordability is better in France than in quite many other countries. On the top of it, there is a number of social mechanisms, including social tariffs, but also a solidarity fund, water vouchers, to ensure that even the poorest households have a means to cover their water bill. So that, and again, that is all something which is backed by the French law. In addition, for situations which are more recent in a way, such as nomadic people, etc., the government, in this precise situation, the prefect requests the municipalities to install a standpipe to serve these nomadic populations. So that is something which, again, I mean, strongly governed by the central state, even though ultimately the water responsibility and the way the service is delivered is down to the municipalities. Is that the answer you wanted?
Yeah, thank you very much. I'm going to turn next to Georgia, who's the director of the Regulatory Agency for Water, Energy and Basic Sanitation in the Federal District of Brazil. He's also the vice president of the Brazilian Association of Regulatory Agencies. So what I'd like to do is hear from the perspective of a regulator, what do you think the role of the regulator is in this very difficult scenario? Have you had to find ways to balance the interests of utilities and consumers? And what do you think the role of regulatory agencies should be, and also what the role of governments should be to take up the conversation we were just having?
Yes, thanks, Clarissa. Good morning, everybody from Brazil, and thanks SWA for this event, this panel. As we saw, the number of obligations and responsibilities of the companies, sanitation companies, increased a lot, and we need to guarantee that mainly the vulnerable people are receiving water. So, as regulators and responsible for follow of that, we have a big responsibility too, as regulators, to keep everything working. By contract, we need to maintain too the economic financial balance of the water and sanitation companies. But it's not only by contract, because they have the operational costs, and they have to invest too. They have to keep investing to looking for the universalization of the service and the ODS 6, if you really want sanitation water for all. So we have to think on all that in during a period where we don't have only a healthy crisis, but together with that, an economical crisis, and people are losing their jobs. People are becoming more vulnerable under this situation. People are not paying their bills, and we are talking about the water and sanitation companies too. We have in Brazil some municipalities where we have more than 50% of the consumers not paying their bills because they don't have money. So how to deal with that situation? Of course, in Brazil, we have all kinds of situations. We have rich areas, we have poor areas, we have good companies, big companies with money to invest and to support all that. But in other cases, not. So in each case, we have to negotiate and to analyze and to have information. What we are doing at this moment is to trying to collect and to orientate all the agencies to do that, to keep very well informed and to try to negotiate with the companies to keep people receiving good water and sanitation services. We have the regulatory triangle where we have in one vertex the government, in the other one society, and in the other one the company. In a normal situation, we try to keep the regulation in the middle, in equidistance of all of them. Yes, but at this moment, what we can see is that this triangle is not very well balanced, because we are trying to cover the problems we have and provide water for all, even if the company is not keeping the money or reducing, they are reducing their revenue. So after that, we'll have a big challenge to recover that. And maybe, we don't know yet, in some cases, the government will cover that, but in some cases, the market will cover that, and in some cases, the tariffs will cover that. And it will be very difficult, the discussion, under a recession period. And with people with no money, with the government with not enough money to recover everything, all the losses that we have during this period, and with people with no money. So, and the company also. So it will be a big challenge for all to deal with that. And for sure, the regulatory agencies will have a very important role on negotiating the future investments that was predicted, the tariffs, because it must be affordable too, because what to do in a place where 50% of people is not paying for their bills. If we increase the price, maybe this number will increase too. So we have to think a lot about that, and to be open to negotiate with all during this period, and with the help of the government for sure.
Great, thanks.
Could I come in a quick one here?
Sure, that's Al Hassan. Do you want to come in
Yes.
quickly, and then I'm going to turn to our two economists and let them speak, but go ahead.
Yeah, so basically for me, what we are saying is this is a major crisis, and government have to step up. We can't say some places the market will play it, or government will play it, or tariffs will play it. This is a major crisis, unprecedented after Second World War, we could say. And we've seen some governments are stepping up to the point that they are paying even 90% to 80% of people's salaries, not to talk about water. And we say that water is the first defense against any pandemic, especially COVID. So for us, what we want to make it clear is that it's the responsibility of the government, and they have to step up. In case where government, we have states that are very poor, we should see it as a public good and a global good, that we have institutions already which are working as public institutions to protect everybody. The World Bank to IMF, everybody has to pull along and make sure that countries that are so poor that they cannot afford to pay for their citizens, we have a public fund that is pulled together to pay for that. It is not time to deter around and say that there are some institutions that would pick this bill. It's clear that this has to be government's responsibility and a global good and public good as well.
Thanks, Al Hassan. That's a nice segue into the question that I wanted to pose to Dale Whittington, who's here. He's a colleague of mine at the Department of Environmental Sciences and Engineering at the University of North Carolina. And I know that, Dale, you've been thinking about this issue about how the losses that we're talking about here should be allocated and how they should be shared. So what are your thoughts? And then I'll turn to Luis Andres.
Well, thanks, Clarissa. Does it sound okay?
Yep, very good.
So maybe we can just stand back and look at the big economic picture here, and I'll try to put in context what we've heard so far and think about how water utilities fit into the big picture. I mean, as you said, there are huge financial losses rippling through the economy as demand collapses and unemployment increases. And what we're seeing now is that everybody is negotiating to be reimbursed for those losses. So we hear from Al Hassan, about calls for free water, but we're hearing similar calls from participants throughout the economy. The airlines need bailouts, the tenants want, rent holidays, homeowners want mortgage relief, hospitals need money for supplies, but obviously everybody can't be made whole from these losses. These are real losses. And so a key question is how these losses are going to be allocated. Who's going to bear them? And I think most people would agree that owners of capital should be the first people to bear these losses, not labor. So then the question for us is today, what does this mean for water utilities and their customers? And the first point I want to make is that it's difficult for water utilities in the global south to allocate losses to capital or owners of capital because they're publicly owned and they don't have much debt. So Dominique said, that in France, you have to sort of cut CapEx expenditures, but that's not really an option for utilities in the global south. Because they basically, their revenues go to labor and supplies. So they can't stop making debt payments. So their operating expenses can't really be cut if they're going to provide services. And I take it as obvious. I agree with Al Hassan. This is a public good that we're not going to be cutting services for water and sanitation in developing countries. So what do we do? And I think for utilities to borrow from the capital markets right now is really not an option. So there are really only three possibilities for allocating losses. The funds can come from higher level government, which is what Al Hassan has asked, or international donors. Payments to labor can be reduced, or customers, most customers are going to have to keep paying their water bills. If everybody stops paying their water bills, utilities are going to face a budget shortfall that's going to be very hard to fill. So Clarissa, let me stop there. That, in terms of allocating losses, there really aren't a lot of possibilities here.
Thanks very much, Dale. And I think you've articulated that very clearly, that we're in a tight spot. I want to turn to Luis Andres now. He's the lead economist at the Global Water Practice of the World Bank. And Luis, are you there? I can see that you're there.
Yes, please.
Can you turn on your video?
Can you hear me?
Yeah, we can hear you.
I'm having
turn on your video.
I'm having some issues now with my video. So,
okay, no problem. We can hear you fine. Let me just. The reason I wanted to call on you, Luis, is that I know that this is an issue that the World Bank water practice is very worried about right now. In particular, you've done a lot of work on tariffs and subsidies. And I wonder if you can speak a bit about targeting. We've been talking a lot about calls to make water sort of free or discounted across the board. We're going to talk with our Ghanaian colleagues next, where the president has announced water is free for 3 months. Do you think that there are some things to be said about how perhaps subsidies could be targeted so that, as Dale has said, it might be possible for the majority of customers to go on paying their tariffs?
Yes, excellent. No, definitely in the water practice of the World Bank, we have been working quite extensively on this topic. I mean, in particular with the COVID reality at this stage, this exacerbates some of the issues that we saw before whenever we were analyzing the subsidies. I think it's critical, as the previous colleague mentioned, I mean, that the cost recovery equation for the water utilities is being compromised even further because of COVID. And probably some of the situation can last longer than the crisis. I mean, and that's some of the issues that we are anticipating. As a practice at the World Bank, we are advocating for the country to start thinking about how to fund some of these contingency plans for the water utility, but also to try to find solutions on how in particular, the poor, the vulnerable, the marginalized group can keep access to safe and affordable water services. Probably the first challenge that we see in this scenario is how we assess, how we quantify the funding gap that is being somehow exacerbated right now. I mean, Haran mentioned something for US. I mean, this is a first attempt, but also we are having some similar exercises in other countries to quantify the cost recovery gap due to COVID. I mean, and one way that we are promoting and piloting in some of the countries is to do some kind of a quick exercise with a simple spreadsheet to start sort of getting at least an estimate on this funding gap. It's important to first starting to get a number, right, in terms of what is the challenge. Second, we are discussing in some of the countries, I mean, and in particular in some regions, and this is the case, for instance, in Latin America and somehow in Africa, to come up with a liquidity facility that, in one hand, puts some clear rule of the game on how governments should be supporting the water utilities, but also some understanding on what are the sources of funding for this facility, what are the institutional arrangements, and what are the actual modalities and conditions for the disbursement of these utilities. I mean, it's in there that we get into these discussions on how we can be smarter on using the subsidies to target to those that are supposed to be reached. So for that, it's important to come up with some clear, transparent, tangible, verifiable rule of the game. I mean, and it's important also to avoid inefficiencies associated with the traditional subsidies that we already documented. At this stage, most of the subsidies tend to go to the non-poor. I mean, and so how we can shift using better data, using more target mechanisms to reach out those area of population. What's important, and I finish, is that it's clear that some of the subsidies tends to have some unintended consequences. So it's important to design and condition the use of these subsidies towards to some performance indicator of the utility we have. Otherwise, this will be somehow exacerbating the longer term consequences of the crisis, but also on the use of additional subsidies for these utilities. Thank you, Clarissa.
Okay, thanks very much, Liz. And I'll ask all the panelists to turn their video back on, because I have a question that I'd like to put to all of you. I also see that there's some interesting questions coming in through the chat box. So one of the questions I think we're seeing is how much resilience is there among utilities? Did utilities have a cushion, or sort of what is the general sort of how much resilience do they have, and how well can utilities around the world withstand this? I would also like to put a second question to you that I'm hoping you'll all be able to speak to, which is that on this panel, we have this very interesting range of stakeholders. And Sanitation Water for All is a platform that is all about partnership and bringing stakeholders together. So what do you see the prospects are for working together? And is there a sort of partnership solution which could be brought to bear to this very complicated situation? Would anybody like to go first with either of those questions?
I'm happy to go.
Okay, off you go, Alassane.
Yeah, so for me, the question of resilience is dependent on country from country. So we've just done a global survey looking at a couple of countries on the impact of COVID on the finances of utilities. This survey was done with Water Integrity Network. And we find out that 28% are kind of worried about delayed of payment, and about 30% think that there is no change in what's happening. And then you have about 15% don't know what's happening. And then you have like only 4% that said payment has increased. So basically there is something there that we have to watch out about, the resilience of utilities post-COVID, or even whilst we're in COVID, because we don't know when we're coming out of this.
It would be interesting to hear our utility partners also speaking to the resilience question.
Yeah, but in terms of collaboration to work on this, and for us as civil society, and we are interested in protecting the rights of citizens, but also we are concerned about the status of viability of the companies. Because if you don't have a viable utility, there will not be water that will run out of the taps, and then you would not be able to meet the human rights. And that's why we are saying that this is an obligation of the state, and the state has to take the lead. Whoever has to contribute to is second to the state. It's a responsibility, and state is first. And we would like to collaborate with everyone here to make sure that the state play its role and play it properly. And for the development banks and other multilateral institutions to pull along and support the state. I'm happy that Luis Andres has talked about the mapping out exercise. And this is something that we would be happy to also provide the data that we just got from various utilities about their state and their worries.
So let me turn to the utilities and have them speak. And I mean, one thing I would be very interested in hearing about is whether, as you say, if the answer is that the state makes utilities whole, to what extent does that potentially also compromise their hard-won financial autonomy and independence from the state? I know that this is something that many utilities struggle with.
So I could go first, if that's okay.
Thanks.
So basically, on the first question, that how resilient are utilities? Speaking for ours specifically, it's certainly not. We're living from hand to mouth. So this pandemic found us like living from hand to mouth, and obviously has opened our eyes. And I think the opportunity for us to work together closer as stakeholders is more critical now. And I think one of the people attending this webinar has even suggested, why don't we look at opportunities where we can have a levy built in for future, so that in future we could be able to say, if this type of pandemic came, we would be able to tap in from it, or even use that levy method to be able to build in infrastructure and be able to take care of this. I think these are very good thoughts, because this definitely there's no fat that exists within utilities. And what else could we do? What aspects do we think that we could do in terms of working together, in particular with sanitation and water for all? And I think this pandemic, again, you know, you always learn from the hardest times. I think we've all realized that we all have one goal, and that goal is to ensure that we provide water, and it is a critical goal in sustaining the sustainability of our livelihoods, all of us, in whatever shape or form. So we need to now look and work closer together, reduce duplications, because with the different ways that we're working at the moment, I'm sure we're making a lot of losses, and we could work closer and collaborate better in terms of providing this service in whatever shape or form. So I think SWA could take up a higher level in terms of its responsibilities in bringing these stakeholders together to ensure that we actually can better learn from each other and can reduce wastage.
Thanks very much. Dominic, did you want to come in on that as well?
With pleasure, yes. Definitely in terms of SWA, I think there is a great deal of experience which is gathered within SWA, and even further, I truly believe in the international cooperation to derive best practices on pretty much all aspects of water management. And so there is a lot to learn from within the Safe Water for All network. Regarding the action to be taken at state level, again, water management, drinking water supply and wastewater management are basically solidarity mechanisms, and there is a strong need for that to be crafted at state level. There is nothing else than the central states to, again, put together the body of legislation that do reflect on this solidarity level, which is expected by the population. And I strongly insist on that as being absolutely instrumental. And I would agree with the earlier speaker who said that resilience is very much something which is local. But when we say resilience, the resilience is within and outside the utility. And this is where, the sort of surrounding environment which international bodies know about, whether at UN level or World Bank or etc. This enabling environment is absolutely crucial. And this is why, at central state level, there is a lot to be done in declining and putting into flesh what are the criteria in terms of the access, what it means, what it doesn't mean in terms of the affordability, what is expected in terms of the affordability, and that is in itself answer this payment conundrum, which was mentioned earlier on by Dale. This is really where there can be a consensus, a national consensus, which fits within the local culture, within the local values, etc., and makes the best of the international knowledge.
Thanks very much. I'd be interested if any of the other panelists want to come in. I'm looking at some of the questions that are coming in the chat box, and I see that there's questions about things like how to target subsidies, particularly for people living in, say, slums or informal areas or in rural areas. And I know that Jabu mentioned the difficulty of working in rural areas. So if any of the panelists would like to speak to that. I see that there's a suggestion in the chat box that water subsidies could be based on volume of water, water used, but we know that that's not always a particularly good proxy for poverty. And of course, delivering subsidies that way only reaches the people who are connected to the network and already using network water. So I'd be interested to see if any of the panelists wanted to speak to that issue about how you reach the most vulnerable, poor areas, slum areas, people who aren't even connected yet.
Clarissa, before we go there, let me just jump in on the last conversation. I think it's important to realize that it's just too simple to ask the state to step in to make all these losses whole for water utilities. The demands on the state right now are huge. I mean, we're in the water business, and so we want money for water. Everybody is asking the state for money. And I think the calls for free water for all miss the fact that not everyone needs to get their water for free now. I mean, so it's, to take Luis's point, we really need to target this better. If we give free water to everyone now, there's at least two big problems. I mean, one is that it's going to be very expensive. And the second is it's going to be hard to back that up. I mean, it's going to be hard to reverse that policy. People get used to free water, and they're going to see the idea that, you know, they've had free water for 6 months. How are we going to reverse that and go back? I don't think we're really focusing on that, how the policy changes again when the pandemic is over. And finally, free water for all is going to make the problem worse for utilities because people are going to be using more water. I mean, if you make water free, the quantity of water is going to go up, costs are going to go up, and the budget deficit for the utilities is going to get worse.
Thanks. And I think Louis wants to come in on this. Louis, are you there?
Yes, I mean, I'm here. I mean, and I fully agree with Dave. I mean, just to complement, I think that on the targeting per se, I think at least we can use a kind of a very basic concept of geographical targeting, right? So by definition, if we are subsidizing slums, I mean, it's quite likely that we will not have to a big area of inclusion on that. I mean, including non-poor over there. So I think those kind of mechanisms is not perfect, but definitely will be far much better off than whatever we are doing at just subsidizing utility without any kind of targeting mindset. I think the challenge probably is how we can reach out those that are not connected to the water utilities, right? I mean, those that do not have an actual pipe connection, that even sort of IBTs, inclusive block tariffs, or this kind of targeting will not reach out on that. I mean, and for that, thinking about how we can provide a cheap solution for them and delivering sort of alternatives to water provision now more than ever, I think that will be critical. And for that, I mean, this will require far more thinking in terms of how we can deliver water to those populations that are more in stress.
Thanks very much, Louis. We're almost at the end of our first panel. What I can do now is perhaps just go to each one of the panelists and ask them if they want to make a sort of final summing up statement or address any of the issues that they feel are left hanging in the air. We've covered a lot of ground in this panel. Maybe I'll go to Jabu. Do you want to go first? And
Yeah.
I've just got a plea from the interpreters that everybody should speak more slowly. The French interpretation is being made very difficult because everybody's speaking too fast. So thank you.
Thank you. So thank you, Clarissa, and thanks to the panel. So I think maybe my parting words would be: these are really truly unprecedented times. I pray that we have all learned from them, and we are going to make the most of what we have learned. My key takeaway is: let's treasure the environment. Let's understand that we cannot do without it. Water is a very precious resource. Can we be better stewards of water? And let's continue to work together to see how we can increase access to water for all.
Thanks very much. George?
Okay. Yes, my final remark is based on the questions you did. Yes, about resilience, we have not only difference between countries, but inside the country and sometimes inside the cities. And the other question about the slams and so on. Yes, there are people trying to introduce some technologies to help on that too. Some equipments that limit the amount of water at least the minimum for people to have some water to live decently. In some areas like that here in Brazil, and with that we can open another discussion about the use of technology to gain efficiency on our systems, and with that resilience too, because we will need to do that, because with efficiency we can maybe reduce prices and reduce tariffs and so on. Yes, I don't like the idea to give forever free water for all, but we need to think about how to deal with that, and subsidies for sure they are important. I have already visited some places where water is for free and people are doing terrible things with water on that places too. We need to think about that, and the question about efficiency. And as regulators, we need to be very transparent. We need to have good information to communicate well with people, because they must know what they are paying for. So and they must have good services too. We have to take care of that. And in some slams and some areas here in Brazil, it's forbidden for the company to go into. So we need to negotiate with the judiciary, the executive. We need to put everybody together to deal with that problems that we have all over the world. And thank you very much.
And I think that some of the things that you've just raised will come up in our next discussion about with the Ghanaian colleagues about this issue of transparency and communication with customers. So thanks for bringing that up. Hassan, are you itching to talk? Yes, please.
So for me, the question of free water, I don't think free water necessarily leads to wastage or people getting lazy to pay for their service. The COVID pandemic has brought up the good side of people and then the bad side of some people as well. So we should not take it when one person or some few people do something bad, then we lump everybody on that score. If I go to work 5 days a week in the office, I use free water. That is because it's free, my company pay for that. And I don't waste it because my company pays for that, okay? Ministers and the governors and all this and use free water. And I don't think that they are wasting water because they don't pay for it. So we have to put this free water thing into perspective and not lump it like that. People who cannot afford in crisis should get it, and we should make it that this is the priority, and make sure that we defend the utilities also to be able to meet that demand and no go bust. So I would say that we should put things into context and not have a blanket kind of description about how this is going to be a problem. It's not going to be a problem if we have built-in communications, effective explanation, how we're going to monitor that. in communities, people are responsible. And some of the slums where we cannot go because they are not seeing the benefit of governance. They think that everybody is stealing from them and they are suffering. So it is important that we communicate with these people and sit with them and have a chat, and we'll resolve this. Thank you.
Thanks. I'm sure that some of our panelists might have some responses to that. I think it'll be interesting when we go to our Ghanaian discussion where, in fact, the free water, the period of free water has resulted in quite a large spike in water use. So we've got a sort of real world example. Dale, did you want to come in on that?
Well, I've got two last points. One is on your question of resilience. And I just want to make the point that perhaps surprisingly, countries with more privately owned utilities have an advantage in dealing with the COVID-19 crisis because the private companies are more resilient because for exactly the reason that Dominique mentioned. They're actually making payments now on debt, which countries in the global south, water utilities in the global south are really not. And so they can stop those debt payments. They can ask for debt relief, which is what everyone else is doing in terms of in the economy right now. So we can allocate those losses to capital in privately held companies. The UK, for example, the share prices of UK water companies have fell by almost 40% in March. So they went way down. Okay, that's one point. I mean, the last point I want to make is that my bottom line is that, like Louise, I just don't think you should give everybody a free water tariff holiday. And if you, as a utility and regulator, if you can avoid that, you should try really hard to do it. I agree with Al Hassan that if somebody really can't afford water, they need it for free. I mean, I agree with that, but a lot of people don't. A lot of people are still employed. And we're going to, I think, pay a heavy price throughout the world if we go on a water holiday for very long.
Thanks, Dale. Thanks. Any other final words from the panel? Otherwise, we're at the end of the first hour, and I'll close here. I'll say thank you very much to this excellent panel. Is somebody wanting to come in? Yeah? Yes,
this is Luis, just 2 seconds. I think it's important, I mean, of course, I mean, the COVID is giving us the challenge, but also the opportunity to design things well. I mean, it's important at this stage is to make sure that we don't come out with a monster, but eventually have lasting effect in the sector. So it's important to carefully design these kind of solutions in such a way that are meant to fix the problem that we are having at hand at this stage for the COVID, but making sure that whatever we are creating here will not have lasting consequences for the sector that will be damaging the sector eventually. Thank you.
Okay, thanks. And that's a nice note to end on, the idea that the bizarre though it might seem, the pandemic does represent an opportunity as well as a crisis. So I'm now going to turn to 3 people who have been very patiently listening to this conversation. I'm going to say a big thank you to the first panel. And now we're going to turn to 3 colleagues who are based in Ghana, and we're going to talk very specifically about the Ghanaian situation. We have on the line Dr. Clifford Bryma, who's the Managing Director of the Ghana Water Company Limited, Mr. Joseph Antwi, who's the Chief Budget Analyst at the Ministry of Finance in Ghana, and Ms. Vida Duty, who is the Country Director of IRC Ghana, who I will just mention that IRC is another member of the Sanitation Water for All Research and Learning constituency, like University of North Carolina is. Do we have everybody? Do we still have Joseph Antwi? I'm not sure if we've still got him online. I saw Dr. Bryma there for a minute. Are you still with us? I can see.
Here with you.
Yeah, okay. Is your video working?
It's working perfectly.
Okay, there, now we can see you. Very good, thank you. So let me start, Clifford, by asking you, we all know that at the beginning of the pandemic, the president of Ghana made a decision to announce that water and electricity would both be free for 3 months during the pandemic. And so what kind of challenges has this presented for your utility? What's been the impact on demand and water use patterns? Perhaps you can speak to the situation in which you find yourself.
Since this is the first time of its kind in our operations, when the president announced that, we thought it was so much on our hands, because we are a utility that's just like any other developing country's utility. You don't give people 24/7, and now they want you to provide them with water free. And so the pressure for you to supply 24/7 will be there coming from the customers. And so it was one of the issues that we thought was too much for us. We also were thinking that how was the payment going to be done? Because if you bill the customers, they pay themselves. If government says give them for free, what it means is that you will have to send the bill to government. Government, with its numerous challenges of developing other areas, will they have enough to give you? So it was something that we were also battling with to see whether it's possible for that to be catered for. And also there are areas where our connections haven't gotten to. And once the president makes the pronouncement, everybody will now come onto you to supply. So these are the issues that we will have to address, and then to get the customers water as the president expected us to do. And so what we needed to do was to look at what our domestic billings are, because they are supposed to take for free. We also look at our standpipes, how much our customers consume. We also have houses that connect water, but they resell to neighbors. We have to look at what they also have, and we put all this together and then made a budget for government. And areas where we could not reach, we needed to get 10,000 liter containers to install at those places across all the urban areas in Ghana, where tankers fill them regularly for people to access the water from, and the cost also transferred to government. And that's how we run it. And at least we've gone 2 months now. What we have noticed is that we budgeted a less than 10% increase in the consumption for the first month, or for the calculation of our budget. But in April, which is the first month, we realized that the consumption shot up by 22.8%. And then May, we just gathered our May data. You realize that it's gone up 25% of the baseline. And so our estimation of low consumption, though there will be increased, but lower than a particular level, was defeated. And since this was our first time, we are not blaming ourselves for not getting the numbers right. And so we now learn out of it. And tomorrow, when we are going to do a next budget for that, we will know how our consumers behave in terms of, or in times where you ask them to take water for free. I think for now, this is what I will present to you as my preliminary comments, so that if there are other questions, then I'll go. Thank you very much.
Thanks, and we'll come back to you in a minute. But first, I'd like to turn to Joseph Antwi, who's here. He's with the Ministry of Finance. Joseph, are you there? Can you turn on your video? And the question that I'm going to, oh, there he is, good. And the question I'm going to ask you is how is the government of Ghana helping, and how is it trying to offset the cost of the free water? You told me a bit when we were doing the briefing for this about the government's COVID alleviation fund. So perhaps you can speak to the challenges that you find sitting in your position within the Ministry of Finance.
Thank you for the opportunity. Just as the first speaker talked about, it's a government policy to support the COVID situation for the consumption of water, to be able to reduce the pandemic. And so the president promised 3 months to support water provision to all homes. And just as he said, Ministry of Finance together, our government set up a committee and set up a fund. And out of that fund, government is supporting the water water service providers. And so the current situation is that government has paid April and May. The policy was for April, May, June. We are into 2 months, just as he said. Government has paid Ghana Water Company April and May. And then also paid that of CWSA for April. CWSA is yet to submit their bill for May before they will be paid. So these are my initial comments. If there are some questions, then I'll take it. So just as was said earlier, the time that the issue came up, you agree with me that wasn't budgeted for. And so there was a need to reprioritize some of our expenditures to be able to accommodate this one. Thank you.
And I see that there's quite a few questions in the chat box about the issue of data and whether this was a limitation and how difficult it was to get the data. Clifford has referred to the fact that it was difficult to predict what the impact on demand was going to be. But has it been difficult to do these calculations? Has it been difficult for service providers to try to figure out what their bills to the government should be?
The government depended on the service providers to give us the consumption that government has to pay for. And so the belief was that the service provider gave us what, or provided to government how much government was supposed to pay. And that was what we paid.
Clifford, do you want to speak to the data issue?
Yes, that's what I said. We send them a budget, and I just added a little below 10% as the estimated increase because it's going to be free. And so they gave us ahead of time what we really needed in April. But when the actuals came and we sent the returns, we realized that it was beyond that. But for May payments, the government had made that balance onto us for us to be able to take care of the excess ones that we got. So the expectation also is that in May that we are going to have an increase. Government will pay for that in June for us to run. And so for us, for now, we don't have any challenges in terms of the finances coming from government.
Okay, I'm going to ask Vida to come into this conversation because one of the things I wanted to ask about was the rural-urban equity implications. And we know that the utility that Clifford runs serves urban areas, but what about the protecting people in rural areas and the limitations and challenges there, and also the data limitations? Vida, do you want to speak to that?
Yes, thank you very much, Clarissa, and good afternoon to everyone. It's nice to hear how the urban utility is resolving this issue, probably because of the way they are structured. But for the rural water subsector, it is much more complex. As we speak now, we have about 18% of the population either with limited water service or depending on unimproved water services. So it is very good that government came out with a policy to provide free water for these 3 months. But for most of the rural population, people living in peri-urban areas and in slum areas that do not have water connections, sadly, they cannot be able to enjoy these free water services. The affordability issue is resolved for only those that have water connections. As part of government policy, government said water will be provided. So there will be tanker services to the areas that are not served. Sometimes this can be convenient in the urban areas. But for most rural areas without these services, this is a big challenge. So that's the first challenge for the rural water area subsector. If you look at the rural water subsector, there's lots of patchwork and fragmentation. As we speak in the rural water subsector in Ghana, there are over 28,000 boreholes, over 4,000 hand-dug wells, and over 1,000 small town water systems, all under different management arrangements through 260 district assemblies. Most of these water systems do not keep proper records. So when we're talking about production level and all the nice things that we see happening in the urban utilities, we do not have the rural water subsector, most of the facilities having this organized type of information. Also, as pertains in other areas in the rural water subsector, which is not peculiar to only Ghana, we do not have clear information on where these facilities are, how they are working, and how they operate. So for the urban water, it will be easier to submit that information to the Ministry of Finance, vetted and paid off. But for the rural water subsector, there's a big challenge as to how to provide that credible information that would enable them to be paid off for their expenses. As has been explained, government requested information on the operations of the water system because they were using the historical data to be able to establish how much it will cost. And this has been a big challenge for the rural water subsector because of the patchwork and the fragmentation that we have.
And particularly ironic, as you say, because there are many more vulnerable people in those rural areas. I was hoping also that the three of you might be able to speak a bit more about the logistics of doing this, but also the communications that are necessary. And I was hoping that Clifford would speak a bit to this about how you explain to people how this free allocation is going to work, and in particular, how you get them back to paying for water when this 3-month tariff holiday is over. Would any of you like to speak to that? Is Clifford able to speak to that?
Yes, we structured the system even from the utility level. We have the head office or the national level COVID-19 free water team, which is headed by myself. At the regional level, we have the regional COVID-19 free water headed by the regional chief manager. And then at the district level, we have the district COVID-19 team headed by the district manager. The district manager is supposed to communicate with the local authorities. That is the assembly person. We have 10 areas that we call unit committees, which deal directly with the people. And so we deal with them, and whatever communication that we have, we pass it through them to get to our people. And if they also have issues to communicate with Ghana Water Company, they come through the same route. From you go to the district office, the district team will receive the information, pass it on to the regional team, and if the regional team cannot handle it, then they now bring it to the national level committee. And that's how we communicate, and we have used the radio stations extensively to communicate and then to put out flyers how these protocols are supposed to be followed. So we've not had much difficulties, though along the line, people still don't go through them. They still want to call the radio stations and then make their communication. Because we have thousands of radio stations in Ghana, you might be giving the communication through one radio station and the consumer is listening to another radio station. And so you are not getting to get the customers the way you want. And so the district teams are supposed to go with our mobile vans and then communicate whatever decisions that we take onto the people. We have an issue for March bills. Because we do postpaid, we're supposed to be receiving our March bills in April. But the president made a pronouncement in April. And if you are not careful, you will distort the system. And so we had to communicate send messages to the customer that the March bill is for information. And they are going to pay that March bill in July, because July there will not be a bill coming because the June bill would have been paid for by government. And so we will not send the March bill in July for them to pay. But those who don't want to have any challenge with payment, they went ahead to pay their March bill in April, though they were receiving the April this is for free. And we started the communication to them to make sure that we don't get into a confusion. But we know that we are going to have a challenge with customers moving off from a free system and coming to pay. And so we are bracing ourselves for that challenge, that we will have to do a lot more education, do door-to-door, to be able to bring the customers back to the normalcy, so that they know that whatever bill, water they take, subsequently will have to be paid for.
It's quite a complicated situation from a communication and billing perspective.
Exactly.
There's a question that came in through the chat, which was whether the free water also applies to businesses and also to health centers. Can you speak to that? Who was eligible for the free water allocation?
We are doing that to our domestic customers. For the hospitals, these are those that we call government bills. So already government is footing that bill. It's not the hospitals themselves that foot the bill. And so that is not a challenge. But the businesses, even currently there is a challenge with the hoteliers. They misinterpreted the presidential directive as if everybody is supposed to take it for free. And there's communication now running on radio stations that Ghana Water Company is flouting the presidential directive by billing the hotels. So we are just sending a letter directly to the association that they are not parts of that directive, because the president focused on the domestic customers to be able to wash their hands and then do some hygiene for themselves, so that they don't get caught in the COVID problems. And so the businesses are not part of it. We're thinking of giving the sachet water, the packaged water suppliers, the free water. But history will tell you that if you give it to them for free, they will not give it to the customer for free. And so there is no point government taking up that bill when the end user is not going to have that benefit. And so we ended up not including them. And the presidency agreed with us that once the end user is not going to have that benefit, there's no point giving it to those businesses.
I see that Jabu from Eswatini has a question for you. So I'm going to ask her, I'm not sure if she's there. She's asking about how you differentiate between old customer debt and new COVID-related water usage. So what did you do about your customers who are already in arrears with their payments?
Oh, the arrears are still intact. Nobody is touching the arrears. And so when your current bill, we write on the bill that's COVID-19 GOG paid.
Does that answer your question, Jabu? You can see that's a difficult, it's a complicated issue when you've already got customers who are in debt.
Yeah, and I also just wanted to check from the colleagues in Ghana that how are they going to differentiate the old debt, and also how are you going to ensure, or what was your debt situation even prior to this? Because typically, you don't necessarily get full payment in utilities. So how was it prior to COVID, and then how was your communication and your debt management before this situation, and how do you think it will be impacted by this particular imperative?
Usually we collect between 85 and 90% of the domestic bills from our customers. And for this instance, we get 100% because we take every bill to government and government pays 100%. And so we are better off now than when the COVID support was not there, because you have to spread the 100% over a longer period. But within this period, we get it at a one go. We don't need to go around to collect, because we just go to one customer to pay for everybody, which is government. And the meters are being read all the time. Even now that is free, we still bill you, but to say that that amount of money that you were supposed to be paid has been paid for by government through the COVID-19 support. And it all are indicated on their bills.
Thanks very much.
Clarissa.
Yes, Vida, we have about 5 minutes left, so.
Yes, so I want to quickly explain the communication, how that was handled in the rural water subsector, because that is more complex. So the Community Water and Sanitation Agency, which is our agency for rural water, was the one that was charged by the ministry to coordinate the process for the rural water subsector. But then because of the complexity, again, in the rural water subsector, the communication wasn't that direct. So CWSA prepared the guidelines. The guidelines were sent through their regional offices to the 260 district assemblies that we have. But because the district assemblies do not report directly to the Ministry of Sanitation and Water Resources and Community Water and Sanitation Agency, the Minister of Sanitation and Water Resources had to write to the various district assemblies, encouraging them to cooperate with Community Water and Sanitation Agency in implementing the free water. And so the various district assemblies then wrote to the various water and sanitation management committees within their respective jurisdiction on the free water. And then they prepare the information and send it backwards to the ministry through the various district assemblies to CWSA regional offices, and then to the Ministry of Finance. Because of all these processes and miscommunication, there were some challenges. First, most water vendors abandoned their posts because they were not sure of how their commissions will be paid at the end of the month. So initially, there were a little bit of chaos at the standpoint where you go, and even though you are supposed to have free water, there are no water vendors or operators to operate the system until later that they were explained and then later on they came back. We also have a lot of private sector operators in the subsector, and most of them were also not too sure whether they would benefit from the payback that government had planned for them. So there were some initial problems with the communication because of the multiplicity of stakeholders in the rural water subsector, which took some time to resolve. And I believe that even with all these resolutions, for the rural water subsector, there's going to be a lot of gaps because they may not be able to properly prepare to respond to the demands and the requests that come with the free water.
Okay, thanks, Vida. Certainly an extremely complicated situation, and I'm very grateful to our three panelists from Ghana for shedding some light on what they've been, the work that they've been doing. I think do you feel there are many lessons here for the future? I mean, let us hope that this is the last pandemic, but I don't think we can be sure of that. But do you feel in general that it has taught you some interesting things about the gaps and shortcomings of the sector?
Sure, I think that we should see the COVID as a challenge and also as an opportunity. It will be a missed opportunity if we just go through these and then maybe after July, we revert to paying water and then think that all is well. I think for the rural water subsector, applying this policy has really opened up a lot of the fragmentations that we've been talking about. And it will be a good opportunity for government and the sector to really look at how we properly structure the sector, deal with the issues of the data inconsistencies, deal with the issues of the operational pitfalls. We don't have good management on operational systems in place. A proper oversight to ensure that we have consistent information on what is happening. I think it's something that needs to be looked at. There are too many fragmentations in the governance arrangements that needs to be streamlined. And so in most cases, it's very difficult to pinpoint at where to place accountability within our sector. And so we can learn from the lessons from this free water to properly streamline the things within the sector so that we can have a strong and robust water sector that is serving our people and providing that sustainable services beyond COVID.
Thanks, Vida. Thanks very much. Really appreciate that wrapping up. I'm going to turn over now to Patrick Moriarty. He is the chair of the Sanitation Water for All Steering Committee, and he's going to make some closing remarks. But thank you very, very much to all of our colleagues from Ghana. Patrick, over to you.
No, I was muted. Good. Thank you very much, Clarissa, and thanks to everyone. I think this has been a really rich and interesting exchange, and I hope and well, I'm sure it will be one of many to come. I think for me, it's, you know, in my role within Sanitation and Water for All, one area that's really dear to my heart is to hear more from particularly some of the people we heard from today, from utilities and from regulators. Clearly you hold the keys to much of our joint ambition for achieving the Sustainable Development Goals in the long term and for responding to the COVID crisis. And I think, frankly, at the moment, you're underrepresented within the partnership. So I think it's fantastic to have you on, and I would encourage those of you who were on and spoke and aren't already members to join, and any who are on in the audience and aren't already members to join. I think we have some great representation from private sector utilities through our private sector constituency in SWA, but much fewer from the public sector utilities, who of course are a really important player, and from the regulators. And I really liked the point I think that Jorge made about the triangle of government, service providers and users, and with regulators somehow trying to hold the middle and balance all those competing interests. I think it was really interesting having this discussion. I think it was also really important, of course, to note, and as I did in the chat, which I was enjoying as well, on the side, that of course our utility partners only provide services to a relatively small part of the population, particularly in sub-Saharan Africa, obviously not everywhere. And that in having this discussion about the importance to balance consumer protection and utility financial stability, it's really important not to forget that some of the poorest and most excluded people are completely missing out on any subsidy that governments are giving to the utilities because they're not customers of the utilities yet. So I think, as a last substantive point, we talked about protecting utilities, protecting partners in the face of COVID. I think what's really important for us as a partnership is to think about how we can use this crisis, use this appalling disease, to fly the flag of water and sanitation and hygiene, to bring the critical importance of our sector to the attention of the powers that be, of our presidents and our prime ministers, highest levels of the executive, and to make sure that not only during the crisis, as we've been discussing now, but after the crisis, we remember to keep investing in water and sanitation. Because for diseases like COVID, where there is no vaccine, where hand washing and safe water and access to water in your house so that you don't have to share a hand pump with 300 other people, when those are the only barriers there are to the spread of the disease, then it's really important that we all keep hammering out the message that a health response is a WASH response, or that a WASH response is a health response. I think this is a huge opportunity for our sector. And I kept hearing that coming through in the interventions we had. What I also really liked about the discussion today, and it's always my job to remind everyone of this, it is, as Clarissa said at the start, that Sanitation Water for All is a multi-partner partnership, a multi-stakeholder partnership. This event today was led by the Research and Learning constituency, and thanks very much, particularly to the Water Institute for hosting it and moderating it. But it was great to have so many private sector colleagues online, NGOs as well. I didn't hear, yes, some of our external support agencies, one or two of our government members. So I think that Sanitation Water for All's power is its membership, and it's the diversity of that membership. That diversity is our strength. I think this, look out, I know that there's going to be a blog written from this. I think it really interesting exchange. So that will be shared onto the SWA website after the event. It'll also be written up in the UNC Water Institute's WASH Policy Research Digest, which is a publication that many of you may know, a nice publication that's put out by UNC. Today we did French and English. I said SWA is a multi-partner, multi-constituency partnership. It's also a multilingual partnership. So there'll be a follow-up to this in Spanish, I think in the reasonably near future, hosted by some other members of the Research and Learning constituency. And also do keep an eye out. I noticed that one of the things we're doing lots of under lockdown and under COVID is webinars. What I find is very useful about these, is particularly what was going on on the side of this, that as well as listening to great speakers and being inspired, there's actually a huge amount of interaction going on in the chats on the side of these webinars. So I'm looking forward to more of those to come from the Research and Learning constituency and from Sanitation and Water for All more broadly. So I think at this point, it just remains to thank everyone involved, particularly all of the panelists, particularly Clarissa for organizing and moderating the whole thing, and of course the Water Institute and Aaron for hosting it. So thank you very much for a really excellent and interesting event, and look forward to the next one. Thank you.